Hi, everybody. This is Andrea Paquette. I am president and co-founder of Stigma-Free Mental Health Society. Welcome to our Stigma-Free Voices podcast, where we interview people with lived experience, those with passion for mental health, and people that are doing really amazing things in their communities. So today, I am super excited to welcome Jono. Jono, where are you coming in from?
Yeah, thank you, Andrew. I'm excited to be here. I am calling from Boulder, Colorado.
Boulder, Colorado.
Mhm.
Amazing. I'm up in Canada, so we're pretty far away, but we have many guests from the US, which has been really wonderful. And I'm super excited to have you here today. All right. So, what I thought would be a really great way to start is to share a little bit about you. I can share your bio, and then we can jump into some questions. Does that sound okay?
Sounds great.
Okay. All right. So, Jono Wilde is the executive director of the Good Life Movement, which is a nonprofit dedicated to advancing a mental health civil rights movement in the USA. His commitment to this work is deeply personal. And after witnessing his father's long battle with bipolar disorder and the repeated failures of our medical, insurance, and social systems, Jono experienced the devastating loss of his father to suicide. And that was in February 2024, and he was 67 years old. What makes this tragedy even more striking is how common it is. And Jono's story reflects what far too many families are experiencing across the US and many other nations for that fact. That reality is what fuels the Good Life Movement's mission, which is to draft and advocate for a mental health civil rights act, a policy framework designed both to reshape the mental health system and also to educate and mobilize the public in support of this. They call it the Life, Liberty, and Pursuit of Happiness Act,
Mhm.
rooted in the founding ideals of the USA. Because, as Jono reminds us, it is long overdue for America to deliver on that promise for all of its citizens, sick and well alike. Wow. I am thrilled to jump into this conversation with you. I already see so many points that I want to touch on and ask questions for. But why don't we just start with what is the Good Life Movement in a couple of sentences? And what does civil rights for every mind actually mean? If you could tell me a little bit about that to start.
Yeah, and you said a good amount of it there in the intro, so I don't want to be overly redundant. But the long and short of it is essentially that we are a nonprofit here. We were founded shortly after my father's passing there in 2024. And the idea is to advance a mental health civil rights framework to all 50 states here in the US, having them adopt some version of this larger bill at the
Mhm.
state level to serve as a vehicle for a larger national social movement around mental health care. And what we found with a lot of the surveys and the studies that we've been doing and a lot of the reform work we've seen in the US over the last 75 years is that there is a shared desire in the states for mental health to be treated with more seriousness and as a political priority, um, to a much larger extent than it is currently. But what's interesting is that for all of the energy around it, we've never seen a social movement behind it. We've never
Mm,
actually seen a real push in terms of a either a civil rights framing or just the idea that there are enough folks in the states with a mental health issue, which there are, to stimulate a complete overhaul of the system. And so we're trying to connect those dots within what we see as a sort of fragmented space of the mental health community in the US and sort of bring it all together under this framework that the common denominator, whether you're dealing with criminal justice reform or health insurance parity or workplace standards, the common denominator there is that we do not treat mental health with the same reverence we do physical health in this country.
mm,
So
yeah.
let's start there. And that would sort of rope all of the efforts together and then hopefully can stimulate a larger social movement to push this thing across the finish line.
Yeah, no, that's astounding. And So meaningful. And when I think about this, it's the same for Canada. It's not
Mhm.
different up here either. There's so much work to be done. So I applaud you on that work. So you've said before that, not in this podcast, but in other reference, if a foreign government were killing Americans at the rate mental illness does, we'd have launched 10 wars by now. Walk us through the scale, the 1 to 5, the 8-year average wait for effective care, the 47,000 suicides. Why hasn't this urgency matched the numbers?
Yeah. So I'll give you just a few statistics here to kind of frame the problem that we're up against. And again, it's something that if you ask any American, and I'm sure it's the same in Canada, everybody will admit to either their own mental health struggles or somebody in their close network. And so the reported numbers in the States is that 1 in 5 Americans suffer from a mental illness, and that's just counting the reported cases. So the number's likely
Mm,
higher. But if that 1 in 5 is correct, then we know that 5 out of 5 Americans have had a loved one affected by a mental health issue. So again, it touches on all lives.
mm,
The average here in America is that we are looking at one suicide every 11 minutes in this country, which is a staggering rate. It comes
mm,
out to about 47,000 lives lost every year just by suicide. And then if we include deaths of despair, which include liver failure from alcoholism, drug overdoses, things like that, um, I would I would lump all of that under a mental health related death. It's actually the fourth leading cause of death in the U.S. when you take it together. The only thing that's killed more Americans in the last 5 years has been cancer, heart disease, and COVID. Other than
mhm,
that, it's been deaths of despair and it's been suicide. And I often frame it in the context of, what if this were a terrorist attack that took out 47,000 lives? Or what if this were an ongoing war that took out 47,000 plus lives? And, the sad fact is that we've gone to war over a lot less, and we have done it in the name of protecting American lives. And my question is, okay, well, which American lives are we really wanting to protect here? Because if we actually look at the real threats to Americans, and I think Canadians and folks worldwide, I am far more likely to die from cancer, heart disease, or bipolar disorder than I am from a foreign government attacking the states or a terrorist organization. And so I think we need to be clear-eyed about how it is we want to advocate for protecting American civilians. And I think it's particularly potent right now as we come to celebrate our 250th birthday and really kind of reevaluating how it is we want to protect Americans from threats, both foreign and domestic. And mental illness, again, is the fourth leading cause of death in the States. And if we take that number seriously, we should be able to rally not only the public support, but federal funding to implement some of these changes. The same way we don't bat an eye anytime we feel justified to go to war. There's no debate over the cost because you can't put a price
mhm.
on our safety.
Yeah.
So I just extend that same logic to the mental health space.
Yeah. No, that makes a lot of sense. And a lot of what you've been talking about is rights, not reform,
Mhm.
right? So, what is the difference and why does that word choice matter if it does?
Yeah, and that's really the crux of what we're doing at the Good Life movement, and what I think makes us unique to the space in terms of advocating for specifically mental health, civil rights, and our slogan, "Civil Rights for Every Mind." That differentiates us because the reality is that America has been working on mental health reform and healthcare reform for the last 75 years. Our National Institute of Mental Health was actually founded in 1949 following World War II, when we noticed that some of our veterans were coming home with PTSD, shell shock is what we called it at the time. And we realized that there was something below the surface that needed attention. And that started the National Institute for Mental Health. And since then, there have been all sorts of reform efforts, specifically around mental health parity in the states. And our insurance system is broken in a lot of ways, but it is far more egregious if you are trying to get a mental health service covered
Yeah.
under our insurance policies. More often than not, they are not covered. That was part of the challenge that my father was running into. And there have been all sorts of reform work done around that space, including the mental health reform bill that was passed in 2008. So over almost 20 years ago now. But despite that, there are still so many gaps, and we still have so many issues around mental health. It's the number one cause of disability and time lost in the workplace in the US and I believe globally. And again, you still have someone dying by suicide every 11 minutes in this country. So reform has been the focus for the last 75 years. And we think the problem there is that that frames the question as what is it that the system can change and what the system should do, and how can we as citizens fit that system? Whereas calling it a fundamental right fundamentally changes the power dynamic so that institutions, be it private health insurance companies or public institutions, they would all be obligated to recognize mental health and mental illness as a civil right. And then we would see how that would actually change not only the conversation around it, but then what kind of laws get passed in support of that. And I'll give you a quick example. The state of Oregon actually passed in 2022 the right to health care as a state constitutional right. And since then, the health insurance companies that participate in Oregon have had to rise to the occasion and figure out how to participate there. They're actually going to be introducing a public option there in 2027 so that everybody is covered in the state of Oregon. And it's just an example of how things change when it no longer is a question of how we, the citizens, work within the system, but how the system has to respond to not denying us our basic constitutional rights.
Yeah. And it's interesting too, like when people hear civil rights, some will ask whether that's the right framework for mental health. And how do you answer the skeptic who says, this is a healthcare issue, it's not a civil rights issue?
Yeah, I would invite them to talk to anyone who's ever experienced a serious mental illness or even, a minor episode, because what they will learn is that discrimination and the ignorance more largely around mental health in the States extends far beyond just healthcare policy. And I'll give you an example. If I were to have a heart attack right now and someone were to call 911, there would be an ambulance that shows up with trained professionals who know how to provide life-saving support in the moment. And then I would be taken to a hospital where they have all the doctors and the drugs and the know-how to literally keep me alive. And then I would have a standard of care program mapped out probably for the next 6 months of my life, telling me here are the things you need to eat, here's the exercise, here are the drugs, because we know how to deal with heart conditions in the States. Now, if I were to have a manic episode as a result of bipolar disorder, and that would still be a medical emergency, let's be clear, and someone calls 911, it's not an ambulance that shows up, it's a police car.
Yeah.
And I don't get taken to a hospital, I get taken to jail to just, wait it out, right? And then I would just be released without any kind of standard of care in place, without any kind of medication, consultation, follow-up. And so there's a very large divide in the lives of those with a mental health issue rather than a physical health issue. And you can see it with healthcare, of course, and I think that's where people's minds go first and foremost, but you see it with law enforcement. You see it with education standards, like the fact that we all grew up with a phys ed class. We all took PE growing up because it was important for us to understand how our bodies work, but we never took a mental education class, let alone a mental health class. And so you start to see these disconnects, and that was really the experience that I had with my father, was that it wasn't just that his health insurance was limiting the services that he could get, but even society writ large, he didn't feel comfortable talking to certain friends and certain family members about his bipolar diagnosis. Now, had he had a heart condition or a cancer diagnosis, I don't think he would have been so reserved about it. And that just sort of highlights all the ways that this problem extends far beyond just health insurance. I think that's a symptom of the larger problem, which is that we just don't take it seriously enough. So we are advocating for civil rights because we can really point to all of the stages of life that someone might go through with a mental illness and all the ways that their participation in civil life is limited because of it. And that's really the indicator when someone's civil rights are being violated, is when they are denied the ability to fully participate in society while others can. And it's because of ascribed status that they have no control over. So when women were fighting for the right to vote in 1920, they were denied that part of our society and that practice of voting just because they were female. And when blacks were fighting for civil rights in the 50s and 60s so that they could sit at the same lunch table as whites, they were being denied access to that part of society because of an ascribed status. And so it's really the same thing here. It's below the surface. And I think we've always struggled with things that aren't as visible, both in the medical community and then just society overall, understanding that someone with a mental health issue is still a citizen to the full extent of whatever that word means and what we decide it to mean. We want to uphold that. And that's where we think the civil rights piece really comes in.
Okay, that's a perfect segue. So I was thinking, when someone's denied care versus what it would look like under a civil rights framework. Can you tell me about that?
Yeah, and so I'll use healthcare as an example because I think that's one that's been debated for a long time here in the States. And one scenario is that, especially with a mental health condition, people are often deemed not sick enough to receive care. So there are countless situations in which someone like my father, who has either bipolar disorder or schizophrenia or even just major depressive disorder, they might be showing signs of suicidal ideation. And there's a lot of instances in which a child will be showing suicidal ideation, and parents will try to get them checked into some kind of outpatient facility so they can receive help. More often than not, a health insurance company will say, well, they have not gotten to an extreme enough point to warrant us covering this. So it's not life-threatening yet. And more often than not, the tragedy is that only after the child will take their life do the health insurance companies take that claim seriously. And so what we would see if mental health were established as a civil right is that the standard would not be to deny care only to receive care later, if ever. The standard would be that you are given care immediately, and then the insurance companies have to figure out what category it falls under later. The idea being that we are prioritizing the patient, we're prioritizing the human, we're prioritizing what they need, rather than what category or what fine line, fine print in the insurance policy this fits under. That's a headache they've created. They can deal with that. The priority should be that they get the care on the front end, and then we can figure out who pays for it and what gets done on the other side of it. And so that would be an example where mental health as a civil right would force an obligation for care on the front end that we don't have now. And right now, again, it's the question of, do we try to fit the system or does the system try to fit us? And that's, again, the difference between a reform sort of focused initiative versus a rights focused approach.
Yeah. And I think we can bring this under civil rights. It would eliminate a lot of stigma, and especially if the insurance companies were, assisting people in dealing with their mental health issues. I too have bipolar disorder, and I'm so sorry to hear about your dad. And I have experienced mania and depression, and the ambulance and the police officer.
Mhm.
And yeah, even up here, it's not treated delicately. I was
Right.
really lucky. I got the help that I needed, but a police officer did show up. But my point is, just that if we were to look at mental health through this lens, then there would be less stigma.
Yeah, and that's really our larger hope. I often tell people that even if the bill doesn't pass to the full extent that we've outlined it, we would still consider this effort a win if we can just instigate a social movement around this idea that mental health is a civil right. And we feel that that is a vehicle to invite conversation around mental health in a way that we haven't talked about it before, because it always has been kind of pushed behind this idea that, well, it's a healthcare issue, so let the health insurance companies figure it out. But no, it's really something that all humans experience, our mental health and our physical health. Whether you're having a good day or a bad day, we all have mental health in some capacity.
Mm-hmm.
And I think that if we can kind of bring it out and invite this conversation around the civil rights piece, but more broadly, mental health in general, that would hopefully reduce the stigma so that somebody who is then experiencing let's say, a mental health issue, they would not feel stigmatized to the point that they wouldn't go out and actually get care. Because one of the other problems we see, at least in the States, is that 2 out of 3 people with mental health issues don't actually ever receive treatment. They don't even seek it out because they feel too ashamed to admit it to themselves and to admit it to their family. And that's kind of what prolonged my father's issues. He was from that generation that largely didn't talk about this sort of thing. And so when he was finally diagnosed with bipolar disorder at the age of 65, I liken it to him discovering stage 4 cancer rather than stage 5. It had gotten too far along, it had metastasized, and he was too far gone, frankly. And so if we can reduce the stigma and get people talking about this, and even referencing things I had mentioned earlier, like having a mental education class in schools so that people can just understand how their brain works and how those emotions work the same way we took phys ed, that might then smooth things further down the road so that if someone is having a mental health issue, they can talk about it in the same casual matter-of-factness that we do when we have the flu or the cold. And it's just something that we all experience. And the hope is we can get mental health to that point as well, ideally.
I don't know if you know, but Stigma-Free Mental Health Society, we have a Stigma-Free school program. And so we offer very extensive presentations around education and lived experience of presenters who share their story. And yeah, I'd like to see something more ongoing in the schools for sure. But I do know up here in Canada, there's definitely an appetite and openness by the sheer number of 10,000 students that we've been able to reach in a year. So yeah, we're doing a lot of that work, but I definitely think a lot more has to be done, right?
It does. And the irony of this too is that the brutal irony of it, especially in the case of bipolar disorder, is that it's largely manageable if you have access to the right care, perhaps the right medication if your doctor decides that's the route you need to take, and the right psychosocial support, right? The right community around you and the people and the environment that can actually allow you to, take the time if you need the time, whatever the issues are there. And what's weird is that when we look at studies in the US, there's an overwhelming majority that wants mental health to be treated more seriously, and also we want it to be a political priority. So the numbers we've seen is that 92% of Democrats, 87% of independents, and 87% of Republicans all would favor a candidate who makes mental health a priority on their platform. Now, you don't see Americans agree on anything with that kind of uniformity. So it's staggering just how uniform the sentiment is here in the States. But at the same time, there's a difference between what people are willing to express behind the anonymity of an online survey versus what is it that they're actually willing to go out in public and protest about. Because I think the stigma around mental health is such that someone might be willing to check a box on a survey without ever publicly speaking about it. But to get folks to rally and march on Washington and take that next step to advocate for this, that's really the work the Good Life movement is trying to do, is to take what we feel is this silent majority and bring it out into the light and say, guys, it's okay to talk about this. We all experience it. And if we need to be that green light that lets other people come out and express what they're experiencing and have those lived experience conversations, then we feel that would be something worthwhile.
Yeah, completely. Okay, so just a couple more questions before we head off here. I was wondering, what's the single biggest risk or objection you lose sleep over? So, and how do you answer it?
I think the biggest objection that I have come across since advocating for a mental health civil rights framework is that it's too ambitious of a goal, because we want to stimulate a national movement that we saw with the Americans with Disabilities Act in 1992, similar to what we saw with the marriage equality movement and gay rights in 80s, 90s, early 2000s, and then they finally achieved marriage equality in 2015. Civil rights movement of the 50s and 60s, women's suffrage of the 1920s. Like, we want to be in that category by the time we're done with this, in the sense that we feel that this is a large enough issue that enough Americans care about that this could be a large social movement that then pushes the envelope on what it is and how we understand mental health in this country. Um, Obviously, at this stage, it's very new and we're very nascent as an organization. We've only really been working in earnest over the last year or two.
Mm-hmm.
So to then say that in the end we want to be achieving the same outcomes that those movements have, people have said, good luck. It's far too large of an undertaking.
Right.
But I also feel that we have a good lesson to learn from those movements. One is that they started with state overhauls, and states would pass certain constitutional state laws. And then once enough states adopted those policies, then the federal government would come. So we're going to do the same thing. And we're focusing on certain states, Colorado, where I'm at, being one of them. And also, I point to those other moments in US history as indications that we are capable of this sort of thing. When enough people in America finally stand up and say, yes, this is what it is that we need to do. This is the right thing to do. And we actually get out publicly about it. And again, that's the challenge with mental health, is going from private to public in terms of how we advocate. But we've done this before. We've done it with gender. We've done it with race. We've done it with sexual orientation. So I think people just need to get to a point where they recognize that just because we can't see mental illness on the surface, that doesn't mean that it's not very real and just as real as a physical illness. And the lived experience is out there. Again, 5 in 5 Americans at least have a loved one who has dealt with a mental health issue. So the numbers are there too. And it's just about normalizing this conversation and getting more people to at least engage in the debate of, is mental health a civil right? Great, let's talk about it. Let's have that conversation and let's normalize that framework. And then it's not going to be quick, but over a long enough timeline, I think we can get there.
Yeah, no, I love the enthusiasm and the strong belief and the positivity. Yes, it is attainable for sure, especially when you point to the past and the other movements that have happened. I think this is the next one. And then I was just curious, for somebody listening right now, whether they live with a mental health issue or someone they care about, maybe someone who works in this field, what's the single most useful thing they can do today?
So I would say I'll answer this question in kind of two veins. One is personally what they can do for themselves or their loved one with a mental illness is to have this conversation, to talk about it openly, to recognize that a mental illness is the same as a physical illness in terms of how it should be understood. And don't be afraid to initiate the conversation, because you will be surprised by how responsive people are, because the fact of the matter is that mental health is just part of the human condition. So I would say that on the personal front. If they're inspired to take action, they can check out goodlifemovement.org to learn more about what it is that we're doing. We are, again, advocating for a mental health civil rights framework within different states. So if they're listening to this in the US and they want to learn specifically about what it is we're trying to set up in their state, they're also welcome to reach out to me. My email is Jono, Jono, at goodlifemovement.org. And then I just invite them to have more public conversations about mental health. And all of that is an effort similar to the work you're doing to reduce the stigma, to get people to realize that this is no different than talking about if you had the flu or a cold or cancer or some other serious physical illness. And then feel free to join our newsletter. We have a store with merchandise. You can wear that around proudly if you feel like it. Just getting the word out however we can about the effort that we're making here.
Amazing. Thank you so much for coming today and sharing stories and your ambitions and all of the good work that you're doing. Stay on the line. I'd like to chat with you after.
Absolutely.
And so thank you. And everybody else, our Rural Minds Matter peer support training is coming up at the end of this month on the 27th and 28th. So I suggest that you sign up for it to learn skills to support peers in your community. And as well, book a presentation over the summer with youth organizations. We don't stop just because the schools are closed. So we're here to share lived experiences, factual information and evidence-based, info. It's really important to learn. So thank you, everybody. If you're watching this, please share after the fact. We are grateful for those who joined us today, and I hope everybody has a wonderful day. And thank you again, Jono. Much appreciation.
Yeah, thank you.